Okay, so just to say we are back with Dr. Vivian Pinn. We're picking up on the oral history interviews we began yesterday. This is for the Women in Medicine Legacy Foundation's Renaissance Women in Medicine Oral History Project. And I'm delighted to be picking up a little bit where we left off yesterday. We had gone through some of your early years and the places and people you grew up with and the early motivations for medicine and life in the segregated South in your childhood and teen years. And I thought we would start today with that big move that happens, out of high school and on to college. I know that you went to Wellesley, which is a prestigious all girls and a northern campus. And I wondered if you could tell me just a little bit about why you chose that high school. You must have been an exceptional high school student. How did you come to a light on that?
Well, I knew I wanted to go to medical school, so I wanted to select a college that had a medical school attached to it, I thought, but also a good college. And I was fortunate to have a woman who was really part of the national scene, knew people through organizations that she'd served as president of, and she just knew the people everywhere. And she was our guidance teacher at my high school. And
Okay.
So she was working with me to think about places to apply. And I only applied to 5 schools, and Wellesley was one of them. But what made me and I didn't know much about Wellesley except that it was a good school and it was outside of Boston. But I'd been to Boston, so that didn't frighten me. And I really liked the idea of going where there was going to be snow. I don't know why, but for some reason, I picked mostly northern schools because, well, I tell you why. I had seen this fake fur coat in one of the department stores at home, and I wanted my father to buy it for me for Christmas, and they didn't want to. And I said, if I go to school where it's going to be very cold and a lot of snow, I'm going to need this coat. So I was still justifying that coat. I don't think I've shared that with many people, but really it was because of that coat that I wanted, which I did wear all through college and afterwards. Big fur.
What color was it? I want to picture this amazing coat that got you to Wellesley.
Yes. So, but then when I went to visit the other institutions and did the interviews, they all asked where had I applied. And it just seemed every time I mentioned Wellesley, I got sort of and I thought, well, if they're so impressed with Wellesley, maybe I should be more impressed with Wellesley. And it was really the reactions of the other schools to the fact that I had applied to Wellesley. I don't know if they intended it that way, but it came across to me as though Wellesley garnered a lot of respect from these admissions officers at other places.
Okay.
And I heard from all other 4 schools first, and I got acceptances there. And I was waiting to hear from Wellesley. And I remember our mailbox was on the carport of my home. And I remember coming home from school, reaching in the mailbox, seeing a letter from Wellesley, pulled it out and read it. And I had been accepted to Wellesley. And that's when I said, yes, I'm going to go to Wellesley. And actually, when I got there and found out the stiff competition, and I was valedictorian in my high school class, but there was a room full of valedictorians and people. And remember, I came out of a segregated school, and I had learned Southern French. I learned French like bonjour, mademoiselle, comment allez-vous, with the French accent, with a Southern accent. And I had a 99 average in French, and they put me in an advanced French class, and I couldn't understand the speaking because they spoke so fast. So that was one of my major challenges in my first year. Although I was pre-med taking a lot of science courses, my big headache was passing my French literature course, and they wouldn't let me go back to an earlier course because I had done very well on the standardized test and on my grades coming in. But then I got there and saw what a competitive atmosphere it was, but a beautiful college. And I loved it. I studied hard, but I loved it, and found some good friends who until they died, and actually for future roommates. In fact, I just heard from the two yesterday. We had a triple, and so they have been good friends for years. So I did establish a lot of good friendships there. But I studied hard because, there were kids who had advanced chemistry, and I'm competing in chemistry class. And I said, my one lab I remembered in chemistry was bending glass. And I think I burned my hands bending glass because we didn't have the big laboratories and equipment
Right.
that many of the other schools had that these kids
Yeah.
were coming from. And many had been to France, so they could speak French because they had
I
spent time
see.
there. And I'm speaking Southern French. And my teacher had just got off the boat, literally from the Sorbonne, to join the faculty there. She didn't understand a French accent. And from day one, she got on me every time because I could not pronounce Marie like the French do. And from day one on, I hardly understood anything that was said. So I had to, I spent that first semester really studying French, got through well on my science courses, thank goodness.
Yeah.
But my time was devoted to, but Wellesley has a beautiful campus. And there was Pendleton Hall with the chemistry classes, and then the Sage Hall for zoology majors, which is what I was, and a very nurturing. I learned so much at Wellesley that has been a benefit to me since.
And you mean that more than academically, or you mean?
Yes, I mean just
Yes.
in terms of life and living and experiences, and
Yes.
I think because we talked about my being shy. I think we talked about that, or maybe I didn't, but it helped me to feel more independent. And as I was doing well, I was struggling in some courses, but doing well in others, it sort of built my confidence. I never thought that I wouldn't make it. I just thought I've got to make it. And I learned a lot of things that I had not been exposed to in living in a segregated South. And so I learned lessons about society, about etiquette, about an integrated world, in addition to learning how to study. Wellesley used a blue book, so you had to write your answers. They were not standardized tests. And I think that writing really helped me learn how to write, which was of great benefit to me when I was a pathologist. And you had to write your autopsy reports out, not a form, which I think they use now. And then when I got to NIH for my later part of my career, I had many working for me with advanced degrees, but I was spending more time editing what they wrote. I want anything that went out was going to have to be word perfect. And I think I'd read the first paragraph, and if it wasn't right, I'd send it back. And I think that all came, I said, I'm not an English teacher, I'm not an English professor, but that all came from my experience at Wellesley, where you had to know how to write and express yourself. And I think that was a great benefit to many of us who went, and it certainly helped me out, because in government, we're always generating documents, either for written or published reports, or for Congress, or for others. And I just felt each time I did it, it was sort of like being back in Wellesley with the blue book with the exam. If it's going to go out and represent me or represent our office, it's got to be correct. Go back and make this as it should be. So one of the experiences from Wellesley. But I should tell you then that what happened at Wellesley really changed the rest of my life. There was a sophomore Father's Day when all the students expected, when they were sophomores, their fathers would come. And my father and mother did come up in the spring. And my mother was complaining about a pain in her hip. And but she came, and we had a great time. And my roommates had their parents there, and they were so nice to my parents. And I remember finding a hard time finding a place for them to stay, but they came and enjoyed it. So at the end of the sophomore year, I wanted to I loved Indianapolis for some reason. I had cousins and an aunt and uncle there, and we go to visit Indianapolis. And I just thought it was the most marvelous city. And then people laugh about that now, but Indianapolis just seemed like such a wonderful city. I wanted to spend time there. So I took my physics that summer at Butler in Indianapolis and spent the summer with my aunt and uncle and my cousins. And the last day of the course, I finished my final exam and came home, and there was a letter from my mother saying that she was having surgery. And in fact, it was that very day she was having surgery because they had found a tumor in her hip. And so when my aunt and uncle came home, my thing was, I need to get home immediately. I've got to be with my mother, pack up my stuff. I had never flown before, but they drove me from Indianapolis to Cincinnati, because Cincinnati was a hub for Piedmont Airlines. And I got on, I remember we drove, it was during the night to get there for an early morning flight. And I took this little Piedmont prop plane
Oh my,
from
for your
over
first
West
time flying.
Virginia, and from Cincinnati over West Virginia, excuse me, into Lynchburg. And it was rocky. It was one of those early prop jet planes. And I can remember the plane was going up and down. And to this day, I swear I experienced what you see in cartoons. The plane went down. I had a cup of coffee. The plane went down. My cup went down. And then I saw my coffee come down. I swear it happened in that plane. But I made it home and they had found that my mother did in fact have cancer in her bone. And this was what her orthopedist had been treating her with gold shots and Oxford shoes. And I had gone with her to see this doctor just before I left for Indianapolis at the beginning of the summer. And I can still remember him saying to her, Francina, if you wore those Oxford shoes and did those exercises I gave you, you wouldn't be suffering this pain. My mother was very shy. She was very, well, I don't know if it's shy, but she was very graceful and soft-spoken, and she didn't speak up. And of course, at that point, I wasn't the person I am now. I didn't speak up, but I'll never forget, I was standing near the radiator hearing him tell her that. So he continued to treat her with gold shots and exercises. But my father found this lump, massaging the pain in her hip, found a lump. And it turned out that she had a bone cancer that by the time it was found, when my father found a knot, had grown through the bone into the hip. And that incision never healed until she died. It was still there. But she was transferred to, once they found out about the tumor and where it was, they didn't feel capable of handling it that. So she was transferred to Sloan Kettering in New York. And of course, Sloan Kettering being the best cancer center possible. But by the time we got her to New York, from infection from that wound site, from the incision, she had septicemia. So they had to treat her to clear the bacteria out of her blood, which came from that draining incision where the orthopedist finally found the tumor, which had spread right into her hip. I'm being very graphic. Maybe I shouldn't be that graphic. But in any case, so they delayed surgery there. And that's where I see my personality change, because I can remember at that time we did not have Blue Cross Blue Shield insurance, and they would only accept Blue Cross Blue Shield insurance as a credit. So every Friday you had to pay up or you were out of the hospital.
Oh my.
So my father went back to Lynchburg to work to get the money to pay the bill, and every week he would send me money to pay the hospital on Fridays. I saw that it was going to last into the school year, and I could not bear to leave my mother. So I had the family car there, and I drove up to Boston to meet with the dean at Wellesley. And I wasn't sure what they were going to say, but I went up to ask them, could I take a leave of absence to take care of my mother? And I was really, the dean I was meeting with was a very stern woman, and I didn't know how they were going to react. And I have to say that that was one of the kindest moments I've experienced. This stern woman was just very gracious and said, if you need time to be with your mother, go be with your mother. And actually, after my mother died, they increased my scholarship and loans. I was a scholarship student. I did work study and things like that, but at least they made it possible, because half of our family income was gone when my mother died. So, but I went back home. I went back to New York and took care of her. And being on my own with my mother in a New York hospital, and there was still some, I can remember one social worker, I still have her card. This was from 1960. I think she sort of thought that because we were Black, we weren't up to par. And I remember my personality changed. I learned to speak up. And one morning I came in and my mother was in so much pain and the nurse wasn't there. That's when I began to be more aggressive and learn I've got to speak up for her. And being there on my own in New York, I had some Wellesley classmates who were from New York. And even after they went to school, sometimes if I was in New York, in the city late, they let me spend the night there. But I stayed mostly with two aunts, one in Mount Vernon, one in Long Island. And finally, when they went to operate, and I had to prepare my mother for a hemipelvectomy, which would have meant they were going to remove her whole hip and leg. And then the surgery came, then she came back and her leg was there. And I went, oh no. When they took her to surgery, they discovered the tumor had spread too far. So it wasn't going to help to do this massive surgery they were going to do. So essentially, they said she would probably live, maybe they gave her about a month to live. So we arranged to take her to Lynchburg, and that's another whole story, having a special car on the train and the bed on the train. But we took her back home to Lynchburg. The American Cancer Society provided bed and bandages to us because she still had that same wound from this doctor who treated her with gold shots from that incision he made in the tumor. It was still draining. So we had bandages, and American Cancer Society was, to this day, I still give them a donation every year because they were so good to us back in the 60s. And I took care of my mother 24/7 until she died on February 1st. And we buried her on February 4th, which was her anniversary. And I actually saw my mother die. I was with her when she died. I've never forgotten that. And it just, if nothing else, it just made me feel, well, I had that caregiving experience. So when we talk about caregiving, and when I got into women's health, we talked about caregiving, I could relate because I had done it. But at the same time, I would not have ever done anything else. I'm so glad I took that time. And so I lost that semester from college, but I went back, and I remember I went back right after the funeral so that I could start my second semester. And I remember I went into the trains at that time, had sort of a lounge area for women's bathrooms. And I went in there because I was crying. I was still sad. And this woman came in. She was not Black. And she looked at me and she said, "Do you sing?" I went, "No, I don't sing." And she said, and she started singing Around the World in 80 Days, what it is. I can still remember sitting there and I'm like, I'm in here mourning my mother. And I guess she thought I could sing because I was Black. And then she sings this song to me. That's all I remember about that trip back to school, was this woman asking me if I could sing. But I got back to Wellesley, and I was fortunate to have wonderful roommates. We had a triple, and I had the single part and they had the double part. But
Would
they
they have
really
been
got,
white girls, Vivian? I'm
yes,
assuming
yes,
Wellesley was mostly white. You would have been
that's
one of
right.
few minority
Yes.
women.
There were only 4 Blacks in my class, the whole class. And two of them really we were really good friends, and both of them had died. And then 2 in the class ahead of me. There were only 8 Blacks on the campus when I came to Wellesley.
Okay.
2 seniors, 2 juniors, and 4 freshmen. But my roommates, and of course, those that I knew, the 2 Black students I knew, and the others, they were very kind. But I spent most time in my suite, obviously, with my roommates. And one was from Boston and one was from Michigan and then Washington. But they just really looked out for me. They took care of me. They knew I was mourning, but they kept me going. And I got through that semester, and I have to give a lot of thanks to them because they really nurtured me during that time. They knew they helped me. And so we've been good friends ever since. We just exchanged emails a few days ago, and we remain friends all this time. And so, and I really cherish that friendship. So, but how this affected my career was, I wanted to march with my class because we were the class of 62. And that dean allowed me to march with the class. I just didn't go up to get my diploma because I still had some courses to make up. I only needed a couple of courses because I already had that physics course.
Yeah.
But then, so I decided that I should stay in Boston for that summer, because at home I had worked the night shift. I'd work at the hospital as a nurse's aide from 11 to 7. And my father would pick me up and take me downtown to the drugstore. And then I work in the drugstore till 3. Then he'd pick me up. I'd go home, take a nap, and go back to the hospital. And I wanted to do something a little more productive. I was fortunate to get those positions at home. There weren't many jobs in my hometown.
Right.
So I went to the Wellesley placement office knowing I had this semester to make up, and asked them, could they help me find a summer position? And the first one they came up with was with a transplant surgeon at Mass General Hospital in the Harvard system. And I went for the interview, and even though he knew he was looking for a permanent research assistant, but even though he knew that I was going to be going to medical school and wouldn't be there permanently, he hired me. And that was my introduction.
Why did he go past his original
He just said, well, no, he let me work with him as long as I could. So I, be there. If he could through the year, I finished my semester and then through the next summer. So I was going to be there for at least a year and a half. And so I finished my semester at Wellesley. but I was still working during that time. So I would commute out to Wellesley. Oh, I thought I was so grown. I bought this little beat up Renault, little black car for a few $100s. And the thing was so bad that when I would drive out to Wellesley in the snow, the wipers wouldn't work and I'd be on driving the Route
Leaning out.
16 out there with my hand outside trying to clean the windshield. But I loved it. I loved it. So I worked that semester and got my degree, but I at the same time and stayed and worked on, and that's when I applied to medical school.
Okay.
But that was my introduction into the field of transplantation. And there was a pathologist who worked with him who was the immunopathologist for Mass General. And so I worked with both of them. At that time, transplantation was seen more as research. It hadn't gotten to the point it is now. So there was a lot of
Right.
research. There was animal research in addition to looking for lung transplants, which hadn't been done before. I have a paper on some of the experimental pancreatic transplants. All of this was new in research at that time.
It was more lab than clinical at that point.
That's right. That's right. I mean,
Okay.
he was doing transplants on humans, but at the same time, our lab was doing experimentation. And I was working with the surgeon and the immunopathologist. So when I went to medical school in the fall to University of Virginia, I came back each summer to work with them. And then one summer, the surgeon said he didn't have enough money in his grant to pay for an experiment, because they would always give me a personal experiment in addition to what they were doing. So the pathologist said he would pick me up. And so that summer I worked with both of them, but I was based in pathology. And then, so here I am working in pathology, working at on kidney biopsies, because my boss did all the kidney biopsies on patients and the transplant biopsies. So I was learning a lot as well as working. In my senior year, I took 6 months, the summer and 3 months of the fall, as an elective back at Mass General in pathology.
Oh.
And how did I end up as a pathologist? Well, I knew a lot about kidneys. I knew a lot about transplantation. I really wanted to be a transplant surgeon, but very few institutions were even interviewing women for surgical positions.
Okay. Okay.
And most of those were in the South. And after having been through 4 years as the only woman, only minority in a Southern institution in a town that was just beginning to integrate, I didn't think I could handle all that pressure. They were not really thinking about women in surgery, so therefore urology seemed the right thing, but nobody was going to let a woman come into urology at that point. So I wasn't sure what I was going to do, because I had grown up thinking I'd be a pediatrician, but I'd been exposed to a whole new world of research through that summer position that continued and continued. I didn't know anything about pathology except what I'd seen in medical school, and that was very different from the practice of pathology. And I learned what research really was, because both Dr. Bunny Barnes, who was the surgeon, and Dr. Martin Flax, who's the immunopathologist, were very, very particular. And so I learned so much about discipline and patience and research and excellence, which is what they required. So so my senior year, I'm there and trying to think, what am I going to do? Where am I going to apply? When I was at a meeting of the New England Pathology Society, and that always met at the Museum of Science, and they had a cocktail party before the lecture was given. And I was standing there with some of the residents from Mass General in pathology. Yeah. And Dr. Benjamin Castleman, who was the chair of the department, a very, very well-noted pathologist. And I think at that time, there were many of the path chairs across the country were those who had trained with Dr. Castleman. Okay. And Dr. Castleman walked by and walked up to me, and I said, Vivian, what are you going to do next year? And I didn't know, and I didn't know what to tell him. So this guy standing next to me said, she wants to be a pathologist. Ah! And so Dr. Castleman looked at me and he said, well, if you want to be a pathologist, why didn't you tell me? And the guy, and I'm going, and the guy next to me said, she's too shy to tell you. So Dr. Castleman, I haven't said anything, but So he said, well, if you're really interested, come talk to me. I said, okay, thank you. I wasn't about to go to Dr. Castleman's office to talk to him because it's so much respect. I mean, he was a real icon in pathology.
Okay.
But he walked through the lab the next week and said, Vivian, come on in my office.
Oh my goodness.
And he said, do you really want to be a pathologist? And I'm thinking, I'm not from Harvard Medical School. I'm at the University of Virginia Medical School. I'm Black. I'm a female. What chance is there going to be for me to get an internship at Harvard in the Mass General in this department of pathology that's so well respected? And I just said, yes, I'd love to. He said, have your dean send me a letter of recommendation. Well, that was before cell phones, and in long distance calls cost money. So he let his secretary let me use their phone to call my dean at UVA. I mean, all these nice things that happened to me. So I called the dean and said, Dr. Castleman would like a letter of recommendation from you. And he went, for you? I said, yes, for me. I remember the reaction.
Oh
I don't
my
know what he
goodness.
put in the letter of recommendation, because I think he was really shocked that I was going to be considered for a position at Harvard. I mean, I was a good student, but I wasn't number one in my class. I struggled a lot getting through, but a lot was going on. But anyway, about a couple of weeks later, Dr. Castleman walked through the lab where I was working and said, by the way, we'll see you in July. And I went,
Oh my goodness.
so I ended up giving, I didn't have to go through the match program. He ended up giving me a position. They had a training grant from the NIH, from the National Institutes of Health. And that training grant allowed them to bring on trainees. And so I came on as an NIH research fellow, an acting intern, and eventually acting resident. But my primary thing was being a research fellow. So that really got, so while I moaned my mother's death, I never regretted taking that semester out. But if I hadn't taken that semester out, things would not have happened as they did.
In the way that
and
they
that's
did.
how I got into Harvard medicine, to Boston medicine, where I spent a total from Wellesley till I came to Washington was a total of 23 years. I love Boston and the opportunities there. And I got to Tufts because my boss in pathology, Dr. Flax, who had really taught me to do the kinds of things he was doing and was wonderful to me, took the chairmanship at Tufts, and he wanted me to come to Tufts with him. And I'm going to leave Harvard to go to Tufts. And he wanted me to come as chief resident. I said, no, I'm not going to leave Harvard to come over there, chief resident. If you give me a faculty position, I'll come. I'd only had 3 years plus my summers. And I'm saying, no, you got to get me a faculty position. Well, a few weeks later, he came and he said, I've got your faculty position. So we'll see you at Tufts in July. So I did. I went to Tufts.
There you are.
Had a wonderful time there, I must
Okay,
say.
I gotta back you up just a little bit though, because it's a fascinating chronicle of not career planning and strategizing, but serendipitous kinds of people stepping in at the right times with the right mentorship, and you being ready, willing, and able to step up into what they're offering. But we skipped medical school. So I need to back you up just a wee bit, because
medical school.
Before we get on to your position at Tufts, I feel like I really need to hear a bit more. You said you went back to UVA for medical school. I'm assuming that had something to do with your mother dying, and I've read that you wanted to be closer home to your father.
Because UVA is only it's 65 miles from my hometown. We were very close family, because I was an only child. Of course, they were both, my parents both were from big families. And I had aunts and uncles who were really good, but from both sides of the family. But we were really close as a, mother, father, daughter, did a lot of things together, and just very close, a very loving family. So when my mother died, my father really kind of fell apart. He'd always been very strong. His nickname was Bullpen. He was that big athletic guy. You described him
yesterday when we were talking, and I got that impression of a forceful and articulate and determined man.
But we lost, it was a big financial loss. It was a loving loss. And my father was working, and he'd come, because I was taking care of mother 24/7, but he'd come and try to help. But to see his wife fading away and her loss, so
young and so unexpected, and so in a way, what you told me, unnecessary.
He was only 46 years old. She was 46, and I was 19. So, and so for my father, it was a big loss. So I was really worried about him and what he went through, which is what I've been able to advise many other people who lose spouses, that you either get the macaroni women, the casserole women who come because they know you've lost a wife, they come bringing casseroles trying to get your attention, or couples tend not to invite you because you're not a
Right.
couple anymore, and
Mhm.
you don't, and they don't know how to deal with that. And my father, I think there might have been a few casserole women, but he didn't tell me too much about that. But I could tell he was so lonely, and most of our really good friends of the family, they were still friendly, but it wasn't the same of couples doing things
You don't
together.
move in the same way when you're uncoupled. Yes.
So I was very concerned about him. So
Mhm.
I applied to several schools. It's interesting because remember, this is when they still weren't taking many Black students into predominantly white schools. And I
Yes.
won't name, I have to tell some folks, yes, I did get turned down without an interview at a couple of schools that later I ended up doing things with. I didn't apply to Harvard, but I did get accepted at UVA, and I wanted to be close to my father. So
Yes.
that's why I went to UVA. But the first day, I remember my father, I lived in a dorm. Remember, University of Virginia at that time had no women undergraduate students. It was still all male. The
I
only
didn't know
women,
that.
oh yes, it was still all male. They didn't bring women in until in the
And
70s.
what year is this? This is late 60s.
I started UVA in the fall of 1963.
Okay.
And the only women on campus were the nurses, those in the nursing school,
Yes. Hmm.
and the few women in graduate school. And
Okay.
so and of course, they'd had a few Black students, but not many at the university. So, and that
Hmm.
had just started a few years before. Charlottesville itself,
They would be Black men then.
yes, a few Black
Hmm.
men, yes,
Hmm.
before me. Not many, but a few Black men before me in the well, actually, turns out in the medical school there had been a few too. I think there were about
Okay.
4 or 5 and the first woman was in the class ahead of me, and I was the second Black woman to attend and graduate from the medical school.
Right.
So I arrived there, and Charlottesville was still mostly segregated. They were just beginning to integrate some places, but not many places, especially not many restaurants. So I
Hmm.
arrived there, and I was in the dorm that they had for women graduate students. And I went over to the medical school that morning for the first day of class. And I walked in, and I walked up, and I sat in the back of the auditorium. And I looked around, it was getting close to 9 o'clock start time, and I don't see any other women, and I don't see anybody else of color. So I figured they must be late getting there.
Oh.
And then the dean called the roll, and everybody was there.
Oh,
And I realized, especially after being in a school like Wellesley, which was all women,
all women.
that it was me and 75 or so white men.
Oh,
So I'm thinking, now I had worked, at Mass General, so I'd worked
yeah.
along in an integrated setting and all, and been
Yeah.
treated very well there. But this was and I think it's a good thing I had that experience because I had worked with Harvard medical students, male students. So I didn't
Yeah.
feel that uncomfortable, except I knew medical school was going to be difficult. I knew I was going to be in Charlottesville, and I just didn't know how I was going to succeed as the only woman and only Black in this class.
Yes. Yes.
So it came time for coffee. Here, I've got a saving story again, my life seems to have a lot of saving stories. The dean called time for coffee break, and he said, I want you all to go into the lounge, have coffee, and get yourselves in groups of 4 for anatomy lab.
Mm-hmm.
And I'm thinking, I don't know a soul in here. These guys, they're fraternity brothers, their parents know each other, they went to the same schools, and
Yeah.
I don't know a soul in here. And how am I going to get a lab partner and I knew how important it was to have a good working group for anatomy. How important that was going to be, because that was the major challenge in the first year.
Yes.
And I was thinking as I walked down, I'm thinking, I'm not going in that lounge room with all those white guys and, stand there like begging somebody to. And as I was walking down from the back of the auditorium, these 2 guys were standing at the bottom of the steps, and they said, hey, Vivian, you want to be our lab partner? Now, somebody asked me, how did they know your name? Well,
Yeah.
I don't know whether they said, hey, Vivian, or hey, you, or hey, dog. I just know they said, do you want to be our lab partner?
Maybe when roll call went off and there's only one woman's name, it's not hard to
That's
remember.
right. Well,
Yeah.
that was what Kenny said. And I said, well, yes. And they said, okay, we'll find a 4th guy to be our 4th. Come on, let's go get coffee. Well, I hadn't planned to go get coffee, but I went with my new lab partners. And came time for lunch, and they said, let's go across the street to eat lunch. And one of them had been at UVA, so he knew everything. So the group of us went over for lunch. And they really were kind of looking out for me. And it all started because they asked me to be their lab partner on the first day. I think it took years for me to realize how significant that was. This today, when people are talking about DEI and talking about inclusion and belonging.
Yeah.
I think if Kenny and Rick hadn't asked me to be their lab partner, I wouldn't have had that sense of belonging. But once they asked me and I had partners, I had somebody I knew that knew me, it just made a difference for me in going to medical school. And I must say, I think they looked out for me during that first year. I knew the stories of what many women in medical school had gone through, especially in anatomy class. I never had any of those nasty jokes pulled on me. And it turned out that I had two of the smartest guys in the class as my partners. So it worked out. It was a wonderful group. And to be one of them now is no longer alive, but the other one is, and we still stay in touch. We took a picture at our 50th reunion, the two surviving ones, to show that from that first day asked me to be a lab partner. Here we were 50 years later, still friends. And he checks on me every now and then. I check on him, and we remember things. But that incident I point out and I use now as an example, reflecting back, that you never know when a small gesture of outreach can change someone's life. And I have to say that Kenny Greer, he said I can use his name because newspapers wanted to know about it when I gave the story.
Right.
But and of course he always said, "Oh, Vivian, I've been in all boys school, so I just wanted a woman to work with." And, we wanted to add spice, he just dismissive. But thinking about it, I don't know if he realized how brave that was for them to reach out to a Black woman, especially a Black woman at UVA at that time, not have me pushed on them, but to invite me and to look out for me. And then I later found out when some of the Black upperclassmen came back, well, there was only one other, the woman in the class ahead of me. She was the only other Black in the school at that time. And she asked me where had I been eating. I said across the street on the corner, which is what they called the street across from the medical school. And she said, "You can't eat there. They're not integrated yet." And I said, "Well, they are now because I've been eating there." And so I don't think the guys, they hadn't even thought about that. And they just took me in.
And because you were with them, you didn't get
Because I was with them, they didn't put me out. So I later, like about 10 years ago, finally told Kenny, I said, "I don't know if you realize it, but you really took part in the civil rights movement because you helped to integrate the restaurants on the corner, because you took me in and they had not been integrated before. So you also can acclaim that in your life's history, that you were also a leader in civil rights." But, I think back, and when you reflect back of what was going on, it was really brave of them, kind of them, and it made a difference in my life.
Like a generosity that is paid beyond and beyond the smallness of it. Yeah.
Right.
Yeah. I know that you have a very busy schedule this afternoon. I was thinking, just to be respectful of your time, would you like to wrap it up? And when we come back for our next interview, I'd like to ask a little bit more. Those were the personal kinds of interaction that made it bearable. I'd like to know more about the general ambiance of what it was like to be in medical school. And you said it was a struggle at times, but you made it through. And I think people who've had illustrious careers must have flown through medical school and it was a breeze. And I think it would be very valuable for them to hear, no, what happens in medical school doesn't dictate everything that comes next. So I think we'll pick that up maybe at our next interview.
Okay.
And I'll put pause on the recording for now and respect your time for today.
All right. Thank you very much.